health system in Ireland, it's a subject of a lot of debate for a lot of bad reasons. When we wrote about the health identifier and other ways of uniting information, making it easier, to getting rid of the folders maybe and making information flow and information gathering much easier. Could you tell us about what your plans are for that and how it's going to work in the next year?
So the individual health identifier is the first building block to doing that. So now every patient, every person in Ireland has a unique identifying number that is used as an index across systems. That went live as a proof of concept in the second week in September. What that means is we've tested the fact that we can uniquely identify every person in Ireland, we can allocate a unique number to every person in Ireland, and we can share that into systems as they come online. Over the first quarter of next year, that proof of concept solution will be made into an industrialised solution that allows us to connect different systems to it. So in the first quarter, we will have 35 GP practices connected to that. We'll have an electronic health record that looks after epilepsy patients, and we'll have the electronic medical record, which is based out of the Laura Lynn Hospice in Dublin. And that means those systems can start to share information about patients and uniquely identify those patients when they arrive in those systems. But as I said, that is a building block. That's an identifier, that's demographics, that's who you are, where you live, how old are you. The next stage is the electronic health record itself. And earlier in December, we went live with a public consultation that runs till the end of January that allows people to come forward and suggest how they, as patients, public, clinicians living in Ireland, would like to see an electronic health record handled. How do they want to see consent handled? What are their privacy issues? And how do they want health information to be looked after?
Now, your role as CIO, it's a dual role. It's the CIO of the HSE, but also CIO of eHealth Ireland, which also hopes to create systems based on solutions, or sorry, exportable products based on solutions that have been created. In terms of the work ahead, I mean, your track record is interesting in the sense that you've done some amazing work in the UK where, you know, in the case of clinical trials, you reduce them from 200 days down to just a few days. What kind of hopes do you have for solving a lot of the bottlenecks that are, you know, unfortunate and existing in the health system in Ireland?
eHealth Ireland is a new function that it's not clear what we want to make it yet. That gives us a brilliant opportunity as clinicians, as patients and as technologists to come together and work out what eHealth, what a digital fabric for health delivery in Ireland looks like, and then create eHealth Ireland as a function that leads that innovation, allows a startup organisation to come to health in Ireland and say, look at this great idea, let me have a go, help us get this in place. Or indeed take huge systems and understand how they can be applied clinically to what we're doing in Ireland. Some of the things that we've done already through eHealth Ireland is we have the HealthLink product, a solution that actually connects every GP to every hospital in Ireland. Using HealthLink, we can now do electronic referrals. By the time Christmas comes, 50% of hospitals in Ireland will be able to accept electronic health referrals. Next time you're in your GP as a patient, ask for your referral to be done electronically. Because you then as a patient will see that your referral has landed in the hospital before you even leave the GP practice. The confidence that that brings to you as the patient, hopefully, is huge because you know that your appointment is now being looked after by that hospital and is no longer in a post box, in an envelope anywhere. It's in the hospital for people to deal with. Experiences from the UK are significant. One of the things talked about a lot over the last 12 months is what's the difference in time? We talk about the difference in technology and innovation is about 15 years. Most people would suggest that's about the case. But actually one of the things we're starting to land on is if you break that 15 years into 3 5-year cycles, Ireland can skip 2 of those 5-year cycles because it can learn from the mistakes, it can learn from successes of the UK, of other countries, and actually get to the point that by 2020 we've caught up to what the NHS delivers. And that would be a phenomenal place for the healthcare system to be in, where we actually start to talk about real information digitally available to clinicians and to patients.
A slight addition to that question is, what is the hardest thing to change? Is it the technology or the people, the processes?
This isn't a technology project. And I think that's massively important as we go into this. One of my biggest lessons learned from working anywhere in health technology is if you turn it into an IT project, it will not succeed. And to me, that's just hugely important, that this is so much about clinical engagement, so much about clinical and patient leading projects. The CIO of the HSE, and yet I stand up and say I don't want to have IT projects. Projects should be clinically led. We signed a contract and started the clinical evaluation and finished the clinical evaluation of the maternity and newborn system, which goes live in the first 3 hospitals next year. That's been clinically led. And what the result of that is that trainee nurses in Cork just yesterday stopped me in a hospital and say, I can't wait for that system. It does what I, the clinician, need it to do to support my work. Because it's not IT that's unwrapped a box and left it on a desk. It's clinicians who've made it look and feel like the clinical journey.
Now, one of the most amazing things happening in our time is through technology, and you're seeing devices like the Apple Watch come out. You're seeing devices like the iPad become a work tool, an enterprise tool. You're also seeing amazing things happen with genome sequencing, projects like Google's 23andMe. In terms of how you see the future of healthcare, how we can use these personal devices to reduce bottlenecks, particularly among elderly people who maybe, in the health system who could easily be taken care of at home better, for example. How do you see these technologies and devices coming into the fore?
It's huge, isn't it? Technology's moved forward so far, so quickly. Personalised healthcare, personalised medicine is out there as a big topic. How do we actually make sure that the clinical journey is centred around you, the patient, through the information and through the systems that's there? The Internet of Things could deliver so much more into a patient's home, keeping patients out of hospital, allowing us to look at what's there and what's happening. The 2 biggest parts for me next year come together and are perhaps best illustrated through work that will happen in one of 3 of the Lighthouse projects, the epilepsy area, where we will take the epilepsy electronic health record, we'll start allowing patients to add to their electronic health record from their mobile phone. It's not really a big technology advancement but crikey, to do that in a healthcare system that hasn't before really done technology. Imagine an epilepsy patient able to write to their clinician from their phone and add to their record, their epilepsy health record, what's happened that day. But perhaps the most exciting piece that we're planning to look at next year is the sequencing of 1,000 under 5s, so that we can actually look at the genomic sequence of under 5s and understand straight away the type of epilepsy they have. The only way to actually treat epilepsy of an under 5 is to just keep trying the different treatments until you land on the right one. If you sequence the genome and spot the deformed gene, you can actually then target the right treatment straight away. It saves €5 million worth of drugs, but most importantly, would save 90 lives every year. And for me, that's just hugely exciting to be able to take that piece of technology, not just IT, but technology generally, and apply it to a real healthcare setting in Ireland and make a difference in 1 year.
Richard, thank you very much.